Next, it gives me great pleasure to introduce our first speaker, Dr. Thomas Levy. Dr. Thomas Levy is a board-certified cardiologist and bar-certified attorney. After practicing adult cardiology for 15 years, he became aware of the enormous toxicity associated with most dental work and the effectiveness of properly administered vitamin C to neutralize this toxicity. He has written many books, several of them addressing the wide-ranging properties of vitamin C in neutralizing all toxins and resolving most infections, as well as the vitamin's critical role in the treatment of heart disease and cancer. Dr. Levy continues to research the impact of the orthomolecular application of vitamin C and antioxidants on chronic degenerative disease. He has recently published his 11th book titled Hidden Epidemic: Silent Oral Infection, Infectious Cause of Most Heart Attacks and Breast Cancer. Please join me in welcoming Dr. Thomas Levy.
It's always, to me, a great pleasure to address this group. I don't know how big your egos are, but they should be big, because certainly as a group, you're doing really what no other group in the world does, and that is to practice honest preventive dentistry with an eye toward resolving medical conditions, okay? It's just high time dentistry and medicine stops acting like they have nothing to do with each other. And this is a slide I have here where there's an article that you could go to. You can just type in the number in PubMed and you'll go straight to it, or to the abstract, as the case may be. I want to give a little bit of an overview. I should have had an extra slide in here. While some of this is preaching to the choir, I still want to put together it as a body of information and try to show where all the connections are. The first part is to talk about what I consider to be the universal etiology and cause of all disease. And by all, I mean all, 100%. And when that is appreciated, then we can appreciate what toxins do and what antioxidants do. Most of you know my affiliation with vitamin C for the last 25 years. And it's interesting what fate and destiny does to you, but I just sort of got thrown onto a path, and everything that I encountered subsequently magically fit with the previous thing that I had done. I mean, and this went with vitamin C, and now I'm going to give you a little information at the end, just enough to drive you crazy with curiosity, and tell you we now have what I consider to be the greatest advance in the history of medicine. And I'm just saying this to a group. I'm not going to put this in print. I'm not going to have the FDA and all that sort of stuff, but I will tell you, we now have a supplemental way to turn on the gulo gene, and you can start making your own vitamin C. Okay? And while I'm short on studies, I'm long on anecdotes, and eventually I'll share those with you. But then toward the end of the talk, also going to talk about some legal aspects, because just like preventative medicine is the best way to approach medicine, preventative legal measures are much better than dealing with situations after you're already pumping $100,000 to a lawyer and going through all the different machinations of an unhappy patient. Because there will be unhappy patients, you all know that. There's no way to avoid them. So the best way is to have a little pathway that basically has them step in their own mess. Now, in addition to what I just said about vitamin C, I kind of shy away from using lots of touchy-feely type of expressions, this sort of thing, but I will say, I'm going to break that rule just for a moment. and say that collectively this information I'm giving you, aside from the part about the vitamin C actually, is what I consider to be a primary major paradigm shift in healthcare. Okay? And as such, it eventually becomes an obligation on us to anticipate changes in the law and situations where you need to anticipate as well what you're going to be held liable for. Because I'm going to give you some information that's very clear-cut. There's a much larger treatment of it in the book, Hidden Epidemic. But the point is, and I'll state it right here and then I'll get on with the show, is that the vast majority of all chronic degenerative diseases are caused by the toxicity of occult dental infections, period. And if we don't routinely do all the examinations to look for this infections, eventually it'll become a legal liability because you have intelligent patients that do their own reading and they say, why the heck did you do that 3D test on me, doc? Why do I have a big abscess tooth that you don't know anything about? And now I have cancer. Now I have breast cancer. Now I have chest pain. Now I went to get an angioplasty. Okay? And those will be valid questions for your patients to have. That's why I submit this to you with that in mind. So, all disease comes down to redox medicine, reduction oxidation medicine. And we hear a lot about toxins and pro-oxidants. First thing I want to say is a toxin is a pro-oxidant is a toxin. They are identical. They're different ways to talk about the same thing. And this drives me crazy. I mean, if you look in the medical literature, the dental literature, scientific literature, and you're interested in one particular concept, the basic clinical researchers want so badly not to be understood, to have their own little unique grasp on some piece of information, they'll have 15, 20, 30 different synonyms for things, and you think you're wondering what the heck they're talking about. In some of my papers on iron, I chased down 20 to 25 different synonyms for reactive iron, and none of them looked anything like each other. And it's only when you finally get a grip or that you're looking at something like this that you can then appreciate the paper. So anyway, a toxin is simply an oxidizing agent, or an agent that causes changes such that the target molecules, the biomolecules, are oxidized. So a toxin is either directly oxidizes or causes to oxidize. Which oxidation? Loss of electrons. Loss of electrons, loss of molecular function. And it's the loss of the molecular function that is the disease. When enough biomolecules in a unique arrangement, unique concentration, location, that causes the disease. That is the disease. Matter of fact, in sort of trying to refine my concepts about some of this stuff, because maybe I think too much about it, but I can't stop it, is that I'm going to even backtrack and say it's not so much oxidation causes disease as oxidation is disease. The state of oxidation of a biomolecule is disease. It's really that simple. And then this puts you into the situation, say, well then, there are two prongs then to any effective therapeutic approach. One is to prevent oxidation. The other is to repair oxidation. So even though everything we do and all the different protocols, they can be really complex, if they're effective, they're reducing oxidized biomolecules. If they're effective, that's what they're doing. And if you have a good long-term result, it's because you identified and eliminated or largely attenuated the ongoing sources of oxidative stress in the body, which I'm going to tell you the vast majority of the time are dental infections in the form of root canals and abscessed but not root canal treated teeth, gums, and tonsils. Okay, it's kind of hard to get a hold of these days, but if you get a chance, get a hold of Dr. Joseph Issel's book, Cancer: A Second Opinion. I mean, what he did back in the 50s in Germany was stunning. It's just, he was so far ahead of his time. I mean, it kind of, you know, that's back in the days of Klenner. So, all right, so all promoters of chronic disease promote by increasing oxidative stress, and all chronic disease are really, there might be some factor in there that I don't have, but I consider to be these to be the primary factors that result in the increased oxidative stress that results in the appearance of a chronic degenerative disease and the worsening or perpetuating of the chronic disease. So even if for the sake of argument you have someone with whatever the chronic disease is and you're quite convinced that it didn't start because of dental infections or dental toxicity, I can assure you that if they have an occult affected tooth, that's going to make it worse. And that's going to make it harder to manage. And if the person has a cancer, it means they're going to get another cancer. So all chronic disease is the result of infection-related toxins, toxins unrelated to infections, environmental exposure, food, water, drink. Toxins from any source are not good, but we're dealing with cumulative effects. And also remember that toxicity comes in the form, it's not necessarily something physical, all right? Radiation toxicity, that's still increased oxidation. And you still ultimately prevent or repair the problem by either removing the radiation or then trying to repair as many biomolecules as you can. Then the flip side of that coin is you have the increased pro-oxidants and you have the decreased antioxidants, okay? And then interestingly, I didn't have this one in the context when I had this vitamin C story I got to tell you. Increased oxidative stress from compromised metabolic pathways secondary to genetic shortcomings. So we sort of think about genetics as these exotic diseases. They're not that exotic. They're pretty straightforward. They're diseases that cause an enzyme, a molecule, whatever, not to function in a certain pathway such that there's increased oxidative stress. It's just at a certain focus. And that's the focus, okay? You could, some people think it's maybe a bit of an oversimplification, say this causes all disease. Well, especially you have so many different toxins. But a lot of it has to do with the biochemical nature of the toxin, okay? You can, if you inhale cyanide, goes straight into your lungs, and because of its tiny size and biochemical properties, it just goes straight to the respiratory enzymes, poisons them, AKA oxidizes them, and within a couple minutes, you can't assimilate oxygen anymore and you die. But it's still oxidation that did it. It wasn't anything more exotic than oxidation. It's just the location of it and how quickly it happened. You can inhale mercury in your office all day long and do okay until you start getting your multiple sclerosis 20, 25, 30 years later. Okay, so, but it's still just oxidation. And then a real biggie, I'm going to be accelerating into warp speed momentarily because there's just not enough time to give the treatment on everything that I want here, but I want to say that hormonal deficiencies, sex hormone deficiency and thyroid hormone deficiency. in all of the stuff that we talk about with regard to dental infections, tonsil infections, any infection, any focal infection, it really blew me away when I first saw this, and had somebody point it out to me, but the ugliest, most horrible infections you can imagine in your mouth, in some people, can be effectively walled off from the rest of the body by completely normal thyroid function. Okay? We know that virtually 100%, well over 95% of all heart attacks come from dental infections because we can identify the pathogens in the blood clots, okay? But we also know, and you know, that you have many patients with root canals, and they're not getting heart attacks, and their CRPs aren't elevated, and they haven't gotten breast cancer. Why? I can only tell you that the sex hormones and the thyroid hormone promote a state of normal reduction in the body, a minimization of oxidative stress. And it's a chicken-egg thing. Once you have more oxidative stress at a certain site, it's more prone to being pushed into a state of further increased oxidation. In other words, it's difficult to seed toxin-secreting pathogens in an area of perfect redox stability than it is in an area of increased oxidative stress. And of course, this makes vitamin C the ultimate antitoxin. Okay, the stories on that are just incredible, but they should do away with the poison control, whatever they call it, office, clinic, whatever. All it does is delay the true treatment to properly deal with any toxin exposure. Oftentimes, the anti-sera are more toxic than the snake venom. So, vitamin C then prevents and reverses oxidative damage, additionally directly neutralizes the toxin, and strongly stimulates the immune system. So you have a multiple number of ways that vitamin C, as a prototypical antioxidant, this is really the case for all antioxidants. The only thing that gives you the variability of clinical impact of one antioxidant versus another is its unique chemical structure, okay? Something can't impact another molecule unless it gets there, okay? Access. Vitamin C is a relatively small molecule like glucose, and like glucose, it gets everywhere in the body. You know, people get hung up on the blood-brain barrier. Well, let me just say, the highest concentration of vitamin C in the body is inside neurons. It's 100-fold higher. That's 100,000, 10,000, 100,000% more than the blood. So it gets there. The only other place that's close to that is the monocyte, which is 80-fold higher. And what does the monocyte do? It basically delivers vitamin C where it's depleted. So this I alluded to, so you need to look at where's the stress, duration, location, degree, combination of factors, the nature of the toxin. Now I'm going to go through the next slides fairly quickly just to show you that the body of data exists here. Every group is unique, so some of you have heard this, some of you haven't, but I want to, Dr. Klenner wrote a great review article, and if you want to somehow take that huge link down there, if you don't have something on your computer to go straight to it, you'll have a good article. And of course, vitamin C cured polio. That was one of Klenner's foundational papers. 60 out of 60. 57 were cured in 3 days, and the other three required 5 days. And And it was on patients with diagnosed polio. Lots of people will scoff and say, well, they're obviously misdiagnosed. Well, it was in the middle of a polio epidemic. Half of them were documented by spinal taps, and the other half weren't spinal tapped because it was felt that just needlessly putting a needle into the spinal cord could introduce the virus into areas where it wasn't already. And even it cured advanced polio. It took a 9 or 10-year-old girl who already had flaccid paralysis of her legs. That's pretty dramatic. And the only difference was it took 2 weeks rather than 5 days. Same thing with hepatitis. Same thing with viral encephalitis presenting in coma. This was especially impactful to me because when I was an intern at Tulane, I went back home, and one of my friends, family member friends, was out of his head, dying of encephalitis, and I didn't even know about vitamin C back then, but I saw how quickly a raging virus inside your brain takes you out. So to know that any agent could turn that around is, well, nothing short of a clinical miracle. Interestingly enough, in the bias of the literature, boy, you hear about fake political news, there's even more fake medical news, okay? I don't know if they give classes to these researchers on how to write a meaningless article or not. But boy, do they do it well. And they refuse to reach a conclusion. If you go to this is in the New England Journal of Medicine, 1950. I think it's 8 different cases of rheumatic fever. And they describe each case, and they describe the application of vitamin C. And you have a kid that's got tachycardia and fever, and vitamin C, and a few days later, no tachycardia, no fever, also known as cure. And they do this 8 times, and their conclusion is that vitamin C had anti-rheumatic activity, but that more research was needed. Well, you get so tired of seeing that phrase, more research is needed. More research is needed if you're brain dead. Okay. Worked for mushroom poisoning. Cute story about the... I have a lot of confidence in a lot of things, but this particular Frenchman, and there's a report in the literature, found that he could block the toxicity of the Amanita mushroom, which gives you massive liver necrosis and puts you under really quick, with vitamin C and a couple other things, I think alpha-lipoic acid. Well, he would go around and give lectures, and he'd take 3 times the fatal dose of the mushrooms and then show that he didn't die. Well, I guess you have to admire conviction, huh? So I won't be doing that. And, we have animal studies, we have test tube studies, we have clinical studies on symptomatology. All those are fine and good, and they all make their contribution, but there's always the argument, well, especially now, the more something is attacked in the fake medical news, the better it is, okay? And we've known for some time now with elegant plasma studies, those that have the highest vitamin C levels in their plasma live the longest. Clean cut, simple. Survival studies. Forget about whether or not there's less headaches or more headaches, less joint pain or less joint pain. You live longer when there's more vitamin C circulating in your blood for a longer period of time. No known toxic dosage. I think many of you have heard me relay the fact that You cannot reliably make anybody sick or ill or dead with vitamin C. I mean, you might get them to poop their brains out, but that'd be about it. But if you give, usually it's a crazy person, literally crazy, psychiatric, 3 or 4 gallons of water to drink, and they drink all the water in a half an hour, they're going to die. Now, death, I think that means water is toxic. Okay? So you can kill somebody with water, but you can't kill them with vitamin C. And, of course, many studies show not only does vitamin C not cause kidney stones in patients with normal renal function. Anybody with declining renal function can get toxicity from anything, okay? But when you have normal kidney functions, vitamin C not only does not cause kidney stones, it helps dissolve pre-existing kidney stones. There's something I don't have time to go into, but a topic of another book I wrote called Death by Calcium. When people are making kidney stones, guess what they have in great abundance? Calcium. You know, we talk about the calcium oxalate stone. Well, vitamin C and many other things have as part of their metabolic breakdown oxalate. What about the calcium? Takes 2 to tango. Takes an anion and a cation. As far as safety goes, the Dr. Honey Hackey and the Reardon Clinic, I mean, they've given enough vitamin C to choke 100 horses over the years. It's just, you got to remember, vitamin C, let me put it this way, vitamin C is the primary nutrient on which your cells run. So it's like, well, I guess I shouldn't eat too much quality organic food. I don't want to take too much vitamin C. I don't want too much of a good thing. I've never heard of anybody overdosing on electrons. Well, that's, of course, they get electrocuted. That's an overdose. That's an overdose of electrons. You get a lot really quick there. So now getting the primary oral sources of increased oxidative stress, which AKA is the primary sources of increased oxidative stress everywhere. I mean, it's almost, if you have a perfect mouth and you supplement well, you should live your normal lifespan till your body wears out. Unless, you know, you live next to a pesticide plant or something like that that's pouring stuff. It's all toxins. It's all toxins, AKA pro-oxidants. So chronically infected teeth, and this was my realization, and I subsequently talked to a lot of my dental colleagues at the time I started doing this research, and they kind of thought that most infections were painful too. It's just the opposite. Greater than 97, 98, 99% of all teeth with radiological evidence of abscess and infection are asymptomatic. Now, if you have an infected tooth that's asymptomatic, that's destroying your health, that's giving you a heart attack, that's going down into your breast and giving you breast cancer, and you don't specifically look for it as a part of a routine evaluation, you don't know what somebody's glucose is until you take a blood test and find out if they're diabetic. And you don't know if they have an asymptomatic infected tooth destroying their health unless you look for it with a 3D cone beam imaging examination. It's got to be the standard of care. The information we now have indicates that has to be the new standard of care. And that's where the legal angle comes in, because I mean, the law moves like a glacier, no doubt about it. But if you know for a fact that discover what I'm saying is true, but you don't feel like getting a 3D exam, and your patient later gets breast cancer and has a huge abscess tooth, that patient's got a case against you. I mean, it's no, what do you say, no sweat off your back to do an extra test, okay? And guess what? If we want to look at it from a materialistic point of view, this gins up business. This doesn't ratchet business down. Okay, you're going to see so many infected teeth, but how many people over the age of 40 are on prescription medication? High blood pressure, arthritis, headaches. It goes on and on, all right? We're not designed to just get diseases for no reason at all. We're designed to get diseases when we have too much oxidative stress in our body, and the overwhelming cause of that comes from the mouth. So you should be at the forefront of this and play golf or do something with your cardiologist and internist and get a good ongoing relationship. So the chronically infected teeth, root canal. The acutely symptomatic, that's an abscess that's just killing you. The thing about pain with teeth is it's a rate-related thing. So, if you split a tooth, crack it, there's a little bit of seeding inside the apex, and things develop slow, and over time, if you were doing serial x-rays, you'd find something evolving over 6 months. For the most part, that's going to be painless. But if you get a quick breach into the apex with a large concentration, the immune system function is down, and you go from a uninfected tooth to one with a big abscess in 2 or 3 days, that hurts like hell. So I would speculate it has to do with how quickly you put the fibers on stretch. I mean, it's like anything else. If you punch somebody, it hurts, but if you just hit them with the same force and just press on them, like the frog that goes into the boiling pot of water. You can't, a frog or a crawfish will try to get out of that boiling pot of water, but they'll basically stay in there if you heat it up with them inside. So it's all rate. Gum infection, gangrene, chronically infected tonsils. I'll only say this because I don't have a lot of time for it, is that Dr. Joseph Issels in the 1950s had a clinic for advanced metastatic cancer patients who'd basically had all their money taken away from them by virtue of our wonderful mainstream medicine, and so they finally come to Dr. Issels without too much money and with cancer riddled through their body. Well, number one, he found that 98%, I mean, when you really have something that's 98% in biology, just add 2 and call it 100%. Had multiple infected teeth, root canals and abscess teeth. So part of his protocol, yank those teeth out, not all the teeth. And he got a good response. He had his own type of vaccine that he used, not somebody else's, but he would use the cancer to make a vaccine against them. Well, he found, though, that there was a significant number that continued to have heart attacks. And somewhere in the genius that's inside his head, and it took some genius, is he doesn't say why. He somehow discovered that all those tonsils were infected. Okay, and he started routinely doing tonsillectomies, and no more heart attacks. Okay. Now, the big thing here when thinking about the tonsils is get the whole idea about tonsillitis and ugly pocketed tonsils out of here. These are tonsils that look normal. They're infected on the inside. They weren't infected because of streptococci and tonsillitis. They're infected because they're continually draining these infected teeth. So almost all of these toxins looked 100% normal. And in Issel's words, not mine, all, I don't know if he's exaggerating, but he said all of the tonsils that he extracted were grossly infected on pathology. You know all these expressions better than me. Apical periodontitis, apical, you probably pronounce them better too. Apical periodontitis. Basically, I find, especially as I'm talking to more lay audiences, not this audience, that it's good just to talk about chronically abscessed teeth. And that properly puts the image inside people's heads that it's not just some sort of inflammation. It's an abscessed, infected tooth. If you get technical, the core of the tooth is dead. It's necrotic. Interestingly enough, in an animal study, they showed that when you breach the pulp, you quickly develop an abscess. But they have this subspecialty of experimental rats that are sterile mouths. There is no flora in the mouth. You violate their pulp, no chronic apical periodontitis. Okay. It's important, I think, not only to understand how excellent well-done 3D X-ray or 3D cone beam imaging is, it's also important to understand how horrible a standard Panorex is for detecting any significant pathology. I would exaggerate and say it's good for counting the teeth and not much else. But the interesting thing is, and this is like on the cover of the book, is the perfect example of the 2D regular, you can't see anything. The tooth looks fine. And then when you 3D the same tooth, it's not subtle. It's a huge abscess. It's eroding away the sinus bony floor and filling the sinus with mucus and pus. Okay, so I'm not talking about missing subtleties here. I'm talking about missing the big banana. Now, I think it's generous to say the panoramic would catch 50% of infected teeth. I would say, and you probably have your own feel for this now, I would say it catches 10, 15, 20%. Okay. And when you do the subtraction, the digital subtraction, you probably get into the 50, 60, 70% range, especially if you get multiple angles. But a properly done and properly interpreted 3D cone beam should get 100% if it's greater than a millimeter. Okay, less than a millimeter, yeah, you're going to miss some of those. So for abscesses of any size at all, the 3D should be 100%. But, and I want to emphasize this point too, and I'll probably make it again later, is whether it's a dentist or a radiologist, whoever the person is that's interpreting the study, they need to understand the purpose of the study is to look for apical abscesses or apical translucencies, because there's so much information on that study. And you can get, and the interpreter can get lost in the weeds looking at some stupid bony cyst, and they're not even, so you got to tell them what you want. If somebody wants me to interpret an echocardiogram, I can interpret it, and I give them a good, thorough response, and I go systematically through everything. But if they say, Dr. Levy, we're worried about endocarditis on the mitral valve, I can give them more information. I can look at that valve from all different angles, knowing that that's the clinical concern. So if you know, you got to let the interpreter know the primary purpose of the test is to look for infected teeth. Oh, not even remembering my own slides here. Aging is wonderful, let me tell you. I got this particular email from a patient. I am scheduled for a root canal this Tuesday on an upper molder that had been giving me problems for months. The seriousness of my condition did not show up on regular x-rays. Did I? Yeah, there you go. Okay. Which revealed a very large abscess and 30% of the bone above the teeth eaten away. Well, that's what you see on 3D, that lots of times you don't even have a clue is on a Panorex, okay? So I'm just, again, because we're going to evolve into a legal analysis here, it's not a great expense. It's best for the patient. It gives you legal protection. It's all good. More business, more legal protection, and if the patient does what you want, they're going to live longer and they're going to live with less illness. Okay? There's no downside to this. One downside is eventually, not in the short term, eventually there'll be less business for the docs, the MDs. But that's way down the road. Not even worth considering in the short-term scheme of things. But it'll be forever. I mean, your days will be full in the office. Okay. Now, this is pretty much what I've been talking about. I'm not, as you can see, following the slides perfectly. The one point I want to make, too, is that in the book Hidden Epidemic, you know, you want to make assertions that are going to stick with the reader, but you don't want to sound like you're a raving lunatic going on in too extreme a fashion. So you don't want to say infected teeth cause all disease. That turns people off. But we have we have absolute scientific proof, not evidence, proof, that over 95% of all heart attacks are coming from infections in the mouth. And we have less absolute proof only because the studies haven't been done in the same fashion to say that well over 70 to 80% of all breast cancer patients are from infected teeth. I mean, we have this Susan B. Komen jog taking place in New York City now. Come on, people. You're not going to jog away any breast cancer? I don't want to sound like I'm being critical of those people. Their hearts are in the right place. They don't know what's going on. They want to raise money so that it can be wasted on the American Cancer Society and all that stuff. But you're never going to get a long-term solution of a patient with breast cancer if you don't get rid of the infection. Now, you know, we all see these patients that suddenly do wonderful. Well, guess what? They're doing other things at the same time that you're not thinking about, which is maybe they've had a lousy diet and lifestyle, and then when the diagnosis comes in, then they start eating organic, then they start food combining, then they start taking supplements, then they start flossing, then they start going to the dentist, this, that, or the other. It's there, or remember what I said earlier about hormone function, or they find a biological doc and they start taking small doses of desiccated thyroid. Okay, most a majority, is my opinion, this I want to differentiate fact from opinion, it's my opinion that a substantial majority of the adults in the United States and around the world are minimally hypothyroid, okay? And the problem with that is regular thyroid tests diagnose hyperthyroidism, no problem, and diagnose advanced hypothyroidism, no problem. But they're not worth crap for minimal hypothyroidism, and that's the group that allows the dissemination of focal infections throughout their body if their thyroid function is not perfectly adjusted. Oh. There's other things you can do too that we have now. That funny looking guy Malika knows a little bit about this. He is funny. He does look funny, doesn't he? Malika? Yeah, look at him. You need to avoid mirrors. That's okay. Yeah, there. I mean, ozone is magic gas. People say, well, how does ozone work? I say, who the hell knows? I don't know how ozone works, but it does, okay? And it's one of those wonderful things that does everything you want it to do and nothing that you don't want it to do. How great is that? Okay. Other things not used as much, but as a biological dentist, should be an important part of any time you're dealing with extractions, because when you finally do have an infected tooth and you've diagnosed it and the patient is sick and you want to get it out there, you want it to heal up as well as possible too. And you don't want to be dealing with a big recurrent cavitation, things like that. So ozone, vitamin C, platelet-rich plasma, and something that Dr. Huggins, my dear mentor, started many years ago, but it's sort of fallen by the wayside, and it's a really bad idea to have it fall by the wayside, which is a few units of long-acting insulin at the injection sites, okay? Guess what insulin does? It pulls vitamin C into the cell. What more do you want to help resolve an infection than more vitamin C inside the affected cells? Okay, so, and a strong immune system and all that jazz. So the thing is, and there's other things too, but if you don't need to automatically do all of them, but magnetic therapies, when you use the biological North Pole, is a mechanical rather than a supplemental form of electrons. It pulls in a flow of electrons, and that's your ultimate therapy. So I could go on for a long time about magnets. A lot of experience with that, but and now they have the pulsed electromagnetic fields, which are very good. But I worked with a group that put out a little machine, and because Rawls and Davis, I don't know if you know those names, they started out with this stuff about 50 years ago, that I got to know Rawls. And he showed me that even before there was a pulsed electromagnetic device, he had a little magnet on a rotational device and just spun it so that the magnet came around. Well, that's a pulsed magnetic field. I mean, you're moving the magnet rather than something else, but and he got phenomenal results. So I told the guy, I said, what you want to try to do is get a pulsed electromagnetic field that just pulses North Pole. Okay. All of them work on AC, so they go north, south, north, south, north, south. But if you use DC, direct current, of the right polarity, you go north, 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 north. Much, much, much better outcome. Okay? And they successfully made the device. Okay. Already talked about that. So legal considerations, bear in mind that you don't have the right, generally, to something that's really expensive, experimental, or has lots of side effects. Well, vitamin C, of course, is not expensive, established to be effective, and is not really toxic. A lot of this information came from when I was in New Zealand at the time of the Alan Smith debacle on New Zealand 60 Minutes. And I don't know, most of you have probably seen that video at this point in time. And I tell you what, I couldn't believe it. I'm rambling a little bit here, but New Zealand, the High Court of New Zealand ruled that fluoridation was mass medication. How great is that? Okay. You got to remember, New Zealand is a tiny country, but it's not a third world country. So you do something in New Zealand with a small group, a small population, it still gets in the journals, whether they're legal journals or whether they're medical journals. So this, it's extremely exciting to me, not that I care that much about my law degree, but extremely exciting to me to see some lawyers, AKA judges, actually using their brains and actually not just rigidly applying black letter law, but willing to, well, use their brains. And one of the things that was the downfall of, or maybe the uprising of vitamin C, that allowed some of these cases to go forward was vitamins. They registered vitamin C as a registered medicine in New Zealand in 2010. So then how could all these doctors defend themselves against a legal attack saying vitamin C is not proven to do this, not proven to do that? Well, then what's New Zealand doing having it as a registered medicine on their formulary? Must have some benefit. The government approved it. I got a kick out of this. It's not anything to do with anything. But they had this horse's ass in New Zealand. I think he was a health minister or something like that. And they were interviewing him. And they were saying, well, what do you think about Alan Smith, this, that, or the other? And he said, Alan Smith's recovery could have been just as likely from a bus driving by as the high-dose intravenous vitamin C he received. And so I said, then I told this to a large group of New Zealanders. I said, you got to build a new bus station across from the hospital. Now, interesting point, I talk about the ginning up of business. I'm rambling a little bit here because there's a lot of different frayed edges to all of this. When you know better than me how much the general population doesn't really like you. They don't want to go to the dentist. It's not their favorite activity. They don't like the money. They don't like the pain. They don't like the expense. They don't like any of that. They might like you, but they don't like the dentistry. As a result of that, two things are going to happen here as you start doing more 3D cone beam examinations. You are going to identify a barrel full of infected teeth. And believe me, they're all consequential. You're going to see tons of infected teeth. And your better patients are the ones that are taking your advice and say, well, doctor, do whatever's best for me. And, well, the best thing is take the tooth out. Maybe follow with an implant or whatever, but the best thing health-wise is to take a grossly infected tooth out. But, and you tell me this, how many times you can run into a patient that they don't want to deal with the pain, they don't want to deal with the expense, they say they can't afford an implant afterwards, so they say, no, that tooth doesn't hurt me, You cannot take it out. Do whatever else is best for me. Well, when the patient puts you in a half Nelson and says you can't extract the tooth, guess what this disciple of Hal Huggins is going to tell you? You can get a root canal. But you only get one bite at the apple. There's a good data to show, and it's logical, that if the option of taking the tooth is off the table, which the patient has the right to do, they're better off basically having their abscess drained via a well-done root canal and then sealed off versus doing nothing. Definitely the least desirable activity for a hugely abscessed tooth is to do nothing. The only thing is, though, I really think because of what root canals do to so many people, and it kills a lot of people, no doubt about it, is it should be a procedure that's done by the highest volume endodontist. I don't think you really want to have a root canal done by somebody that does 2 or 3 a week rather than somebody that does 25 or 30 a week. Because there is an expertise involved, and the ultimate thing that makes a good root canal is how completely evacuated, how good the seal is. There shouldn't ever be anything like a redo root canal. If the dentist or endodontist doesn't get it right the first time, they shouldn't be allowed to let the patient wallow under another 6 months, year and a half's worth of infective toxicity while they come to the decision that this is an anatomically too difficult to get a good result with. So, a little rambling there for you. See, I want to. It'd be much better 2-hour lecture, sorry. We now have this evidence of vitamin C in sepsis, okay? If you don't know about this study, then you have the reference you can go to. Vitamin C with hydrocortisone basically 100% eliminates the mortality of sepsis at fairly low dosages. This is one more thing that can be used that was not available over a year ago in a court of law with vitamin C. And all of this wraps together. We're talking about infections, whether it's sepsis or whether it's an infected tooth. The basic concepts of what is best for an infection prevail. This was a, the boards are changing. They're not changing fast, but they're changing. I think too many, okay, oof, all right. I got called by a Texas doctor. The board was going after him and didn't like the fact that vitamin C was used, but the experts said in print, I am not aware of any significant uses for vitamin C and glutathione in the treatment of sepsis. Well, when somebody puts it out like that, you can slam dunk them. And I wrote this letter back there, and they dropped the case a week later. I think the boards, both dental and medical, they read the internet too. They see what people are doing, and they're tired of hassling with it. But when an action is started, they have to finish it. But if you give them a good scientific reason without getting hysterical, not to do something, they'll do it. So the last few slides, I got to wrap it up, are these are a few of my practical suggestions legally. Compile a complete informed consent, okay? And modify it as new literature comes in and cite the literature. Number 2, when you do the informed consent, we got these wonderful devices here. Record it, and then put it in a file. The patient is not going to say they said something when they know they didn't. And when they're videotaped, smartphone taped, they know it. Compulsive progress notes. Always obtain biopsy specimens. On websites and in informed consent, avoid absolute statements. And then the silliest one, but one that I ran across, was if an authority like the FDA or somebody says, take this statement off your website, take it off your website. Don't leave it on there. So that's about it.